Good afternoon, everyone, and welcome to this presentation on Health 34, hosted by the UC Davis Campus Community Book Project. My name is Megan Macklin, and I serve as Associate Director of Campus Climate and Inclusion Initiatives in the Office of Campus Community Relations, a unit in the Office of Diversity, Equity, and Inclusion at UC Davis. Thank you for joining. To begin, a couple of housekeeping items for our virtual event. Captions can be accessed by clicking the live transcript button in your Zoom window. There you can show or hide subtitles and access the full transcript. Today's event is being recorded, and the recording will be made available on the Book Project website. And finally, you are invited to ask questions using the Q&A feature. We will endeavor to answer as many questions as possible. While we meet today in a virtual space, we'd like to begin by reading the following statement that acknowledges the land where UC Davis sits. We should take a moment to acknowledge the land on which we are gathered. For thousands of years, this land has been the home of the Patwin people. Today, there are three federally recognized Patwin tribes: Catchell-Dehe Band of Wintun Nations of the Calusa Indian Community, Quetzal-Dehe Wintun Nation, and Yocha-Dehe Wintun Nation. The Patwin people have remained committed to the stewardship of this land over many centuries. It has been cherished and protected as elders have instructed the young through generations. We are honored and grateful to be here today on their traditional lands. The UC Davis Campus Community Book Project promotes dialogue and builds community by encouraging diverse members of the campus and surrounding communities to read the same book and attend related events. The Book Project, a signature initiative out of the Office of Campus Community Relations since 2002, advances the mission to improve both the campus climate and community relations, to foster diversity, and to promote equity and inclusiveness. Currently, in our 21st year, the Book Project in 2022-2023 focuses on the theme of transformative justice and features Defund Fear, Safety Without Policing, Prisons, and Punishment by Zach Norris. Originally titled We Keep Us Safe, Building Secure, Just, and Inclusive Communities, the book calls upon many systems that play a role in the imperative for community safety, including the criminal legal system, healthcare, education, food and housing access, and support for caregivers. This year's Book Project theme and selection will be supported by a year-long program of lectures, workshops, book discussions, film screenings, exhibits, performances, and more. Our program culminates when author Zach Norris comes to UC Davis on Thursday, February 16, 2023 to speak at the Mondavi Center for the Performing Arts. For more information about the Book Project program, visit our website where you can find up-to-date event information, registration links, and other resources. We also welcome your involvement, students, staff, faculty, and community members, in selecting the Book Project featured title and in planning our annual program. If you are interested in getting involved with the Book Project, please send us an email or refer to the Book Project website for more information. Throughout today's discussion, we will uphold our UC Davis principles of community. We recognize that we may discuss sensitive topics, and we encourage you to practice self-care and seek resources when needed. You can find links to the UC Davis Principles of Community and to the Book Project's Mental Health Resources page on your screen. And now it is my pleasure to introduce today's speakers. Serving in the fire service since 1993, Nathan Trauernicht is the fire chief for UC Davis, providing overall leadership and direction to a department that serves a population of over 40,000. Chief Trauernicht earned his undergraduate degree in fire protection and safety engineering from Oklahoma State University and holds a master's degree in public administration. Beyond completing the Executive Leadership and Management Institute at Stanford University, Chief Trauernicht is a graduate of the UC Davis Executive Program, member of the Institution of Fire Engineers, and is designated as a Chief Fire Officer, Chief EMS Officer, and Chief Training Officer by the Center for Public Safety Excellence. Chief Trauernicht is active in a number of professional groups, boards, and committees, including the Institution of Fire Engineers, International Association of Fire Chiefs, California Fire Chiefs Association. He currently serves as president of the Oklahoma State University Alumni Association, Chief Fire Officers Chapter. Also joining us is Dr. Cory Vu, who serves as Associate Vice Chancellor for Health, Wellness, and Divisional Resources in the UC Davis Division of Student Affairs. He also serves as the campus's Chief Wellbeing Officer. Dr. Vu earned his bachelor's degrees from UC Davis and UC Berkeley, and a Doctor of Optometry degree from UC Berkeley as well. He started his career at UC Davis in 2011 at Student Health and Counseling Services, where he served as the Quality Improvement and Risk Manager. During his tenure there, he was promoted to Director of Risk, Quality, Compliance, and Safety, and briefly served as the Interim Executive Director of Health and Wellness. Dr. Vu has served on many committees and work groups on campus, including the Mental Health Task Force, Compliance and Risk Council, Title IX Athletic Advisory Committee, Postvention Committee, Student Wellness Community of Practice, and many others. In his role, Dr. Vu continues to champion programs that improve student health and wellness and student success. Thank you, Chief Trauernicht and Dr. Vu, for joining, and I'll turn it over to you.
Thank you so much for having us, and we're excited to be a part of the book project and share a new campus initiative called Health 34. And Health 34 is about reimagining compassion and also about reimagining how we care for our community in the space before and after a 911 call. And we'll talk about that more as the presentation moves forward. Another important thing to keep in mind as we talk about Health 34 is that this program, this initiative, is unlike any other. So I frequently say we're building the plane as we fly it, which you may say, gosh, in the space of public safety, isn't that a dangerous concept? What I think is more dangerous is us not taking bolder action to solve societal issues around access to healthcare, equity in healthcare, and fundamentally taking care of our communities in a pre-crisis phase whenever we can. And that's what our discussion is going to be about today, how Health 34 delivers on this idea of reimagining compassion. And with that, I'd like to introduce my co-presenter and my co-lead on the Health 34 initiative, Cory Vu, my friend from Student Affairs. Cory?
Yes, thank you so much, Chief Nate. Hello, everyone. Thank you for attending today's Campus Community Book Project presentation. My name again is Cory Vu, and I serve as the Associate Vice Chancellor for Health, Wellness, and Divisional Resources for Student Affairs. And I have the honor and the pleasure of assisting Chief Nate in implementing Health 34 for the campus. Before I turn it over to Chief Nate to describe the Health 34 program, I would like to share with you, once implemented, how Health 34 is a critical piece to supporting student mental health on our campus. Mental health of students continues to be a concern at UC Davis and on college campuses across the nation. Mental health problems can affect the students' energy level, their concentration, dependability, mental ability, optimism, hindering their academic success and performance. Across the country, colleges and universities are facing a huge increase in the number of students who need mental health care. Many schools aren't prepared to handle the growing demand. A national survey of college students in 2020 found that nearly 40% experienced depression. 1 in 3 reported having anxiety, and 1 in 7 said that they thought about suicide in the past year. Here at UC Davis, we're taking a comprehensive and holistic public health approach to mental health promotion and suicide prevention, as indicated by the wheel on the slide. The different facets that we'll focus on include helping students develop life skills, promoting social connectedness, identifying students at risk, increasing help-seeking behavior, providing substance abuse and mental health services, following crisis management procedures, and restricting access to potentially lethal means. As you can see from the list on the left, we invested in various resources and programs through campus and state funding to strengthen our mental health support for students, including hiring more counselors and case managers and support staff that focus on supporting students in marginalized communities, victims of sexual harassment and sexual assault, and those impacted by food and housing insecurity. Other programs and initiatives include creating the AGI Mental Health Campaign, which we just launched in the fall, and the AGI Mental Health Ambassador Program, which we just launched in the fall, providing easily accessible mental health training for students, staff, and faculty, and many others. Health 34 plays an important role in this plan by strengthening our crisis and mental health support services, identifying students at risk, and increasing help-seeking behavior of students. As Health 34 matures, and we're at the early stages of implementing the program will continue to work collaboratively and in partnership with many of the resources, programs, and initiatives I just mentioned, in addition to many of our student affairs units to support students. All of the services that support students' mental health, including Health 34, have equity as the core value, as Chief Nate just mentioned earlier. And with that, it's my pleasure to turn it over to Chief Nate to describe the Health 34 program.
Thanks, Cory. It really is a tremendous honor to work with Cory and the entire Student Affairs team. In particular, Cory's body of work that reports to him is about really fundamentally what Health 34 is about, which is inspiring, promoting, and nurturing community health and community well-being. And there is if you remember back in old movies, the idea of in the Old West or places like that, where the practitioner would come to you wherever you were and offer care. Health 34 looks to deliver what you need, when you need, where you need. And in doing so, reduces barriers to access, creates equity, and navigates people to services outside of the traditional institutional setting of healthcare, and also outside the traditional hours of institutional healthcare. What is Health 34? People ask, where does the name Health 34 come from? Well, health is part of its general vision, which is not only the mental and behavioral health component of the program in terms of service navigation, but also general health and well-being, in particular, low acuity or minor medical needs that our community may be experiencing for the first time without their usual support network. And when we talk about community in relation to Health 34, it's really important that we define who we describe our community as. Our community in terms of service is anyone who occupies the physical space of UC Davis. So while the majority of those individuals may be students, undergrad and graduate, it also has support and resources for staff, faculty, guests, visitors, anyone who comes into our physical space. Health 34 can be and will be a resource and navigation tool for. Health 34 is a team of compassionate Aggies that are specifically trained to intervene before and provide support after a crisis. Health 34 does not exist in the 911 system and is not an alternative to 911. California state law is very clear and very specific about what has to happen when someone dials 911. An example is California law requires that if you dial 911 for a medical emergency and you're taken somewhere, that you're taken by ambulance to a certified emergency room. Health 34 looks to make a difference in people's lives before 911 is called and after 911 is called. We'll talk about some examples in that space here in a moment. We know, as Cory mentioned, that our community has this growing need for expanded access, in particular to mental health and low acuity health services outside and in addition to those offered in a traditional clinical setting. Health 34 looks to deliver support and service navigation 24/7, 365 to the community directly where they are, without having to go to a facility when not necessary, and regardless of what time of day, holidays, seasons, quarters, whatever may exist. Health 34 does not look to be the clinician. Health 34 looks to partner with existing providers to extend their reach and their services in hopes of expanding care to the campus community. So let's walk this back for a moment and think about who are some of these providers. They include many things in Cory's shop: student health, student counseling services, ASAP, occupational health, Aggie Compass, Aggie Pantry, basic needs services, UCD care. Why? Because many of the mental health and behavioral health issues and low acuity medical issues have direct correlations to basic need issues. Many times the two are intertwined. And one of the things that you'll learn as a goal of Health 34 is to break down silos that historically many of these groups and many of these services have operated in, including the fire department. Why the fire department to deliver this service? We have some unique capabilities that are native to who we are and what we do, which is, I I always tell people that probably the most unique thing that the fire service does is it brings a group of people from diverse backgrounds with unique experiences together with a toolkit to help the most vulnerable people in their time of greatest need. There's very few instances where people invite strangers into their homes when they are at their most vulnerable. We recognize the tremendous responsibility that comes with that. And we also, even though we're called a fire department, here at UC Davis, over 90% of our calls for service, which is about 1,200 calls a year, are medical in nature, including mental and behavioral health issues. We have a 24/7, 365 operation. We're used to dealing with all sorts of members of community who have problems that need to be solved. That can be anything from getting their cat out of a storm gutter, to a panic attack, to contemplating suicide, to a fire, to a vehicle accident. And so we have a lot of experience in this space in the 911 frame. Health 34 asks the question, how can we help in that space before and space after? The space before involves the Health 34 team, which is made up of two primary responders. One is an allied health paramedic, and the other is a student EMT. The allied health paramedic is for a very specific reason. Again, I mentioned earlier, Health 34 is not a replacement to the 911 system. If someone calls Health 34 and the unit arrives on scene and assesses the individual and is determined that a 911 call needs to happen because the person needs transport to a hospital, we will initiate that part of the system. And after a 911 call, what commonly happens today is you get a fire truck, you get an ambulance, you may get a police unit there depending on what the 911 call is. And if it's determined that your 911 call is not an emergency, we all just go away. We tell you to have a good day, we wish you the best, and we leave. After the 911 call, Health 34, if someone's going to sign a release at scene, looks to get a team of healthcare providers and navigators there before that handoff happens. So imagine, and this is a common example I give, someone's having a panic attack before midterms or before finals, and someone sees an individual who is inconsolably crying and calls 911 because they don't know what to do. The person can't catch their breath, can't get a word out, calls 911. A fire truck and ambulance show up, the person starts to calm, and that person's not going to get transported to a hospital. But we can do something better than what we've been doing, which is determining the person doesn't need to go to the hospital and leaving. Instead, Health 34 can engage, support that individual, and that support could look like a lot of different things. Maybe they go into their final and we say, we're going to wait here for you. And while you take your final, can we grab you something to drink when you're done? Can we go get you a coffee? Can we get you some tea? Can we get you some juice and meet you back here and talk about what happened? And in that conversation, find out if it's the first time they've had a panic attack. Find out if they're seeing a provider for it. Find out if they're taking medication for it. Find out if they need help getting into a provider and giving them direct access into the systems that are available on campus and beyond to receive help. And then can we go one step further and schedule a follow-up with them within the next 48 hours to see how they're feeling, to see if they need to be taken to an appointment. Maybe they don't have a ride to an appointment, to see if maybe they were having problems with their medications and if they're back on track or if they need further support with taking medications. That's just one example of after the call. The other example that I give after the call that's more low acuity medical related is somebody gets injured on the intramural fields. They're crying, they're holding their ankle, everybody around them is worried about them. Somebody calls 911 and it's not a transport to the hospital. Health 34 can come, talk to them about pain management, the difference between ibuprofen and Tylenol, can provide them a ride back to their residence, can provide cold compress, warm compress to get them through the next 12 hours, can schedule an appointment within 12 hours to come back and make sure the situation hasn't changed and they don't need imaging or services over at Student Health. Why is all this important though? Because right now in America, all health crisis goes to emergency rooms, and emergency rooms are not necessarily always supportive, in particular, of people who are having mental and behavioral health crisis, or even pre-crisis. There's a lot of stimulation, a lot of saturation that's occurring in that space. And so what can we do to take care of people in their moment of need, but not necessarily dump everyone into an emergency room? So where does this idea of Health 34 even come from? It's rooted in a concept called mobile integrated health. That idea I mentioned before of bringing the practitioner to the patient where they are. And mobile integrated health is not a new concept, although it is just starting to gain steam and momentum nationally. We actually proposed a Health 34 concept about 6 years ago. But it was more focused on preventing people from being admitted to the emergency room who had already been seen in the emergency room. So this new version of Health 34 expands far beyond that in terms of how we imagine to connect to the community. We derived Health 34 from several programs that are pioneering in this space around our nation. One is Seattle Fire Health One. Their program has a heavy emphasis on substance abuse and serving the unhoused population. LA County Fire's advanced practice units are very heavily focused on individuals who repeatedly call 911 for basic needs issues that are non-emergent or that are part of chronic health problems. Mesa, Arizona Fire and Medical has been doing mobile integrated health for a long time, primarily initially in the space as a triage unit. So 911 calls coming in that appear to be low acuity in nature, sending a unit with a community paramedic to determine and triage the level of help needed and then get that individual to the right space. There's also mental and behavioral health specific programs that we looked at, like Cahoots out of Oregon and the STAR program out of Washington, which are 27/365 mental and behavioral health crisis units that are staffed with mental and behavioral health professionals. One of the questions that I commonly get about Health 34 is, why are you staffing it with healthcare providers instead of mental and behavioral health clinicians? And the answer to that is we believe, we don't know yet, that the demand for Health 34 services would not support us providing actual therapy and counseling services in the field, that those engagements would take too much time. What we do think our proposal does do with Health 34 is it bridges the gap between someone being sad, being anxious, having feelings of self-harm, feeling like they need help but not knowing where to get it, right? We can be there with someone in a moment and support them and reassure them and then provide them follow-up shortly thereafter with the right service that will support their needs ongoing. And this is built on a series of partnerships across campus, across the 3 counties where the majority of our community lives, Yolo, Solano, Sacramento counties, and all the mental health and wellness services that are available. I mentioned earlier the unit staffed with an allied health paramedic. That individual, as I said, is going to have the ability to make sure that the individuals who call are not having a true medical emergency. That's one important reason. The other important reason that it's a paramedic is because of their knowledge of pharmacology. People get admitted into the hospital for 2 primary reasons. One, is infection. The other is actually kind of tied to infection, which is failure to get or take as prescribed medications. And so the knowledge of pharmacology and the ability to help people understand medicines they're prescribed, and to be able to help case manage with healthcare providers, including mental and behavioral health clinicians, is a really important piece of this. I also mentioned that student EMTs are a piece of this. So an important deliverable with Health 34 is that the community sees itself represented in those providing services. So along with the allied health paramedic, which is the career position that's attached to this, we also have student EMTs that work for the fire department. They're undergraduate students who've been through our EMT certification program, which here in the last year was ranked the #1 hands-on EMT program in the country. They'll be on the unit and helping to provide services to fellow students and to other members of the community, giving them not only a familiar face, but also giving students the opportunity to gain real world experience as they serve in their undergraduate role, just like they currently do with our student firefighter program. There's 2 other positions that will rotate through Health 34 as part of the connection to the academic mission. One is a clinical rotation spot from the UC Davis School of Medicine. The other is a clinical rotation spot from the UC Davis School of Nursing. Why are these 2 groups interested in Health 34? Because they translate into areas of our society and our world that are currently having problems in healthcare. One being rural America, the other being urban America amongst marginalized communities. Health 34, in providing these types of services outside of the typical healthcare institution, they hope inspires the next generation of physician, physician assistant, nurse practitioner, and others to want to deliver care in these innovative spaces. Health 34, as you're probably getting some idea, looks to drive increase to access, improve equity, and remove barriers to care. So while we may not be able to help you with your issue right now, you may even not be interested in our help right now, but we are going to follow up with you and continue to offer services and opportunities to take advantage of those services. Some of the deliverables: increase community of trust, especially amongst underrepresented and historically marginalized communities, in calling for assistance before and during a crisis event. We'll talk a little bit when we start talking about the services, how that is created in doing this. We want to create a model for community-based systems of care that meet people where they're at. Today, I personally have suffered from anxiety and depression throughout my life since I was in my early teens. People who struggle with mental and behavioral health issues oftentimes feel like they don't know where to go, like they don't know how to take that first step. And Health 34 looks to be a launching point for those individuals. And one thing we haven't talked a lot about yet is how Health 34 works in the pre-911 space. When this unit isn't going out to post 911 calls, when this unit isn't responding to requests for service through a 7-digit number that's access or care point, it is out in the community during daylight hours in places where the community is. And they're tabling the resources of all those groups that I mentioned earlier. So we talked about expanding and amplifying health and wellness messaging from campus partners. There's information about all these wonderful services that they're available through campus. But maybe somebody comes up to the table and says, I've been trying to make an appointment for counseling services for the last week and a half, and I just can't. Like, I feel overwhelmed by the whole process. Don't worry, we got you. We can help you make that appointment. And by the way, do you need a ride when that appointment comes? Because we can get you a ride over there. And then we can follow up with you after the appointment to see how you're doing. Did you get your follow-up appointment scheduled? Were you able to get the medications that were prescribed to you? Do you need assistance? Although the medications aren't working well for you, they're keeping you up at night. Did you know that they actually have to be taken in the morning? Oh, when you take the medication, it gives you an upset stomach, so you quit taking it. Oh, friend, you have to take it on a full stomach. And that doesn't mean a couple crackers, it actually means a meal. Oh, you're experiencing food insecurity? Can we connect you to the pantry? You can see how these community-based systems start to become intertwined with each other and supportive of each other, and how they start to take down barriers. Our ultimate goal with Health 34 is to improve health and wellness support and education to the community, and to be there with people in moments where they don't know what help they need. They just know that they need help. Our overarching service goals connect with at-risk community members before crisis. Again, that happens by being out in the community, by tabling, by building relationships, by being in places where the community is. So think of the MU, think of the ARC, think of student housing, think of any place where people gather and congregate, and campus events. So you can plan on us being at events that maybe you wouldn't think you'd have a table of people talking about mental and behavioral health resources, but we're there as part of the crowd, having conversations, and in having conversations, opening up a dialogue. And one thing we already know from promoting our EMS programs like CPR and Stop the Bleed is you start talking about one thing with the community, and because you're offering other services, people pull you aside and say, hey, you know what? I've really been struggling with my mental health. Is there a way we can talk about that? And the answer is yes, there is a way we can talk about it. And this is the mechanism to do that. We want to provide that service navigation using all the partners on campus that we're going to be working with, and do case follow-up. So if someone doesn't come in through Health 34, but is seen by student health or counseling services, and the provider thinks that they need a follow-up, a check-in 12 hours, we can schedule that. We can get a note from Cory's team and go out to that individual, let them know we're coming, take them a little care package. Hey, how was your visit? Did you get everything you needed? How are you feeling? Based on those interactions, can we schedule additional appointments? Can we just spend some time with you? Can we navigate you to other services? We want to support the academic mission through those clinical rotations, and ultimately support and inspire a healthier community. This whole project is not about the UC Davis Fire Department. This project is about all the amazing programs and services that Cory highlighted on the slide that he provided at the beginning of this. And UC Davis, in my humble opinion, is really in the lead amongst the UC system in providing these type of pre-hospital, pre-crisis services, in addition to the services already offered. Health 34, as I mentioned earlier, is about breaking down silos. So while Cory is very kind in talking about where the idea came from, the idea doesn't exist if it just sits with me and sits with the fire department. It relies heavily on campus partners, and Cory is an equal partner in leading this effort with me. Student Affairs is an equal partner in this, but we have a lot of other partners as well. We've started to build out an advisory committee of subject matter experts from across campus in all areas of public safety, in all areas of health, in all areas of well-being, to help inform what it is that Health 34 becomes. So I mentioned earlier, we're building a plane as we fly it. And so what better way to do that than have people who are specialists in all pieces of building the plane as we launch forward. In addition to the advisory committee that gives feedback to Cory and I, that reviews protocols and procedures, gives us new ideas, looks at the CQI information, the continuous quality improvement information that we collect There's going to be operational task groups made up of an even broader group of community stakeholders that looks at our protocols and algorithms, our procedures, recommends training. We're going to have a committee dedicated to how we build community partnerships. So we recognize that there's a number of community groups outside of our campus proper here at Davis that support students, staff, and faculty when they leave this campus. We need to build out those relationships, and we need to find out what they're doing so we can add it to our outreach and education. We're gonna have a group specifically tied to mental and behavioral health that includes not only ASAP, OC Health, student health and counseling services, but also the psychology department on campus, the educational piece of it, subject matter experts from across both UC Davis and UC Davis Health. A big piece of this is data collection, analysis, and public health trending. So one thing that Health 34 does is gather real-time data on what community needs are across all the silos and allows us to feed that up into our community partners so they know what services are needed now and on the horizon. That's actually the area that I'm most excited about with Health 34 is the data piece that's going to help us better inform where we need to put resources in making sure people are healthy and well. And then the continuous quality improvement piece, which is another position that's assigned to Health 34 is a allied health nurse navigator. That person is in charge of managing the partnerships and also making sure that we go through and review every single request for service to make sure that we are delivering on people's needs and that we're following the protocols and procedures set forth for the unit. Fundamentally, Health 34 is about easing the burdens of people's bad days. It doesn't have to get to 911 every time. 911 is always going to exist. And there will always be bountiful call volume within 911 because we can't stop everything from getting to that point. But what I tell people when I talk about Health 34, we can do better than what we're doing today. So when folks ask me, how are you going to measure the success of this program? I tell people, doing this program is already a success. Doing this program, no matter what the outcomes are, is more than we're doing today and is better than what we're doing today in terms of how we care for our community. So we will be launching community outreach and education programs based on health trends. We are going to be providing quick response mental health support services, non-clinical support using referral navigation and scheduled follow-up. We do think at some point in the future, there's going to be a link in here to telemedicine that will allow us to connect people to a provider. We just don't know exactly what that looks like yet because we don't know what provider availability is, but we can be there as that bridge between the point of someone being in a bad space and actually being able to get the help that they need. I mentioned already the scheduled post-treatment, post-discharge well checks for places like student health and counseling services and OC Health. An OC Health example is somebody, maybe injures themselves at work, has to have stitches, is on antibiotics. What was one of the two things I mentioned for admittance into the hospital? Infection, right? So maybe we can help prevent those people from having to be admitted to the hospital by checking in on them when they come back to work. Non-transport fire department referrals. That's why I talk about the space after the 911 call. Health 34 cannot be dispatched as part of 911 under current California law. We hope that changes. We hope that the state of California does what other states across the nation have done, which is recognize there is a space within the 911 system to triage and take people to appropriate levels of care. Whether that's treat and release, treat and refer, alternate transport destination, there's a whole variety of things that can happen that we need California to get on board with. But until then, we will occupy the space before and after the 911 call. And that after space is where the fire department referrals come in, the fire engine saying, hey, we just did a release at scene, but this person needs a little extra support. Can you come out and give it? And the answer is absolutely yes. How will you access Health 34? When Health 34 goes live, it's going to be accessed through a 7-digit number that goes directly to the provider. So again, this goes back to the reason of why we have a paramedic on the unit, because if someone calls a 7-digit access number and we arrive and it is truly a 911 situation, we immediately get 911 resources headed that direction. But the paramedic has both the scope of practice, the experience, and the skill set to make that determination if needed. We also see some other things in the future, which is expanding services, again, outside of the traditional setting to create a healthier community. Things like mobile flu and COVID vaccination services. We do know that at some point, our police department here on campus is imagining that we may take some nonviolent PD referrals. The only thing that's been discussed to this point is well checks. So parent hasn't heard from their student in a couple days, and there's no other reason to really be worried about them other than they need somebody to check on them. Maybe Health 34 is the right resource for those specific instances. But beyond that, we really don't know yet what other referrals might happen from the police department. But those are discussions for our friends in law enforcement to have, and that we can then be a part of when they're better positioned to have those discussions. We are contemplating that maybe there's a future of expanded service that would include text for service, but we actually feel like, and we're doing some surveys on campus right now about how people want to access Health 34. And an interesting thing that we kind of hypothesized that is being reinforced is that people actually like the idea of a human voice on the other end when they need help. And so for now, we think we're going to stick to the 7-digit access for care. We can't be the service providers for everybody. We are building a program and a model here at UC Davis that we hope other jurisdictions adopt. We are piloting something. We are building the plane as we fly it in hopes that other places can use the solutions that we've developed within the framework of California regulation to provide these kind of services. So what is the geographical boundary of the services we will provide? It is limited to the geographic area of the Davis campus of UC Davis. Why? Because this is different. This is out there. This is, as Chancellor May would say, we are going boldly, and we need as safe a place as possible to try something like this. And the Davis campus provides that. Now, what we learn in this process of providing this service on the Davis campus can translate into communities with more challenging issues. And one of the places the campus leadership already sees potential with Health 34 is a mature version of Health 34, having an additional unit over on our Sacramento campus as we look to build Aggie Square and increase the footprint. What a great place for us to provide these kind of services at our medical center, where people from all over the Sacramento region who are challenged with mental and behavioral health issues and chronic low acuity health issues are released back onto the street. So is there a future for Health 34 beyond the Davis campus? Yes, I think there is. At the Sacramento campus, after we've done this with our water wings on and learned and started to develop that next generation, and who knows, maybe the providers on that unit are people who've gone through the clinical rotations through the School of Medicine and School of Nursing and decided that making a difference in the space before and after a 911 call is their calling, and want to continue on this path. We are going to work closely with other regional service providers to align our case management and provide as much flexibility and options as we can in terms of referrals. So Yolo County is working on a program called Crisis Now, which is a countywide crisis program, and Health 34 may refer people to services that are offered as part of that. Part of that is looking at creating a countywide mental and behavioral health receiving center. Maybe UC Davis at some point will buy into that, and it may be a location for our folks who need something that's not staying where they are, that's not an emergency room, but is a place with mental health care providers. So we're exploring all these options in a parallel path to launching Health 34. Again, we're building a program unique to our very special campus community, place I love dearly, that can be replicated for other places. I know we're getting close on time. Cory and I want to make sure we provide an opportunity for question and answer. My sincere appreciation for everybody who joined us today and who will watch this after the fact. We can provide some information on contact after question and answer if people have more questions or want to continue the dialogue.
Thanks so much, Chief Trauernicht and Dr. Vu, for that presentation. I think for all of us having the opportunity to hear from you directly about this really exciting program, very, very much appreciative of that. I invite our audience to post any questions that you might have in the Q&A in your Zoom window, and we will be happy to go through them and pose them to our panelists. I'll go ahead and get us started with a couple of questions of my own. The first is, the first question I want to pose to you is about what makes a university unique for this kind of innovative program? Clearly, we have a very unique population. There are service units that are a part of our university that, might not look the same if we're looking at a different kind of community, but also universities are places for innovation. So what's the role of the university, an institution of higher education, kind of as we're thinking about this really innovative program rolling out?
Cory?
Yes, okay. I know what Chief is going to say is that, one is that, we have a fire department on campus. I think that's a huge advantage, to having a Health 34 program. The other, I think, huge advantage is that, we have an administration that's very supportive of the program, of us supporting students, especially students' mental health, from the chancellor on down. So I think those two things, are critical to be able to have a program like this at UC Davis. Chief Nate, anything else you want to add?
Yeah, I just want to speak to the innovation piece of it. Part of why I started working here 14 years ago and am here today is the opportunity to create programs like this. Because we are known for being a public research institution that is on the cutting edge of solving or helping with some of the world's most challenging problems. Access to healthcare, equity in healthcare, and breaking down barriers, in particular for historically marginalized communities in this space. These are some of the biggest societal problems that we are dealing with today. And I think that is the direct linkage to UC Davis, is the commitment of Chancellor May and everyone who works here to be a part of solving not just the easy stuff, but the really complicated things.
Thank you. We have a question posed by one of our participants. I'll put it into the chat for everyone to see. What type of vehicle will Health 34 responders be in? An ambulance, a van, or bicycles, because it's UC Davis?
That's a great question. So we're in the process of procuring a van. It's almost like a bus, a small bus. Because we want it to be ADA compliant, so that no matter who you are in the community, what your mobility is, that you have access to it. The other thing that it allows us to do is create a private space with an environment that is temperature controlled, that is free of distractions, free of unnecessary stimuli, to have conversations with people and to give them the space to have the sort of navigation services that they need. So it's got U-shaped seating in the back. Again, it's wheelchair accessible, mobility device accessible, and it's important for a variety of reasons, like I mentioned. But having a safe environment, both for the individual and for the providers, is really important, and this type of platform allows us to do that. So we found a vendor and are working through that process right now. So picture a small bus sort of a vehicle for these type of interactions.
Thank you. Another question. How will you assess ways to improve the program as you pilot it?
That's a great question. So part of what we're doing involves continuous quality improvement, which is, if you're familiar with healthcare, it's very common within healthcare in terms of making sure that in the healthcare setting that patients have the desired outcomes, which is improvement in their health and well-being. Part of what the advisory committee is going to be working on in its first several meetings is establishing, based on all the subject matter experts together, what do performance benchmarks look like for Health 34? So, I mean, I mentioned earlier my overarching measure of successes, which is, hey, we got to do something better than what we're doing today. But we are going to create pillars that this is built on. But there's a lot of unknowns still. So part of what we need to have happen, number one, is the engagement of that advisory group. Number two, we need people to start calling for help, because we need to understand what help is needed in a space that we currently have no idea. I don't know if I'm going to have to go back to campus leadership in 3 months after this launches and say, I need 2 more units. Or maybe we get by with just 1. So improvement is going to be based on both the recommendations of our protocols and procedures from subject matter experts in all of these areas, and then that continuous quality improvement process that goes back and brings in those experts to look at how we manage cases, what were the outcomes, and then continually building on the program based on that information. I mentioned earlier, data collection and analysis is a huge part of this. And you may say, this smells a little bit like public health. And honestly, it does smell a little bit like public health, what we're doing, because it is about all the things involved in making sure that communities are healthy, well, and resilient.
And I think also to add what Chief Nate just said too, we'll be relying on the community that we serve, to provide us feedback and help us improve the program as we move forward also. So it's going to be both quantitative and qualitative data that we'll be looking at to improve the program.
Thank you. So when we think about alternatives to crisis response in various programs nationwide, Chief Trauernicht, you mentioned a few of them. Something that I've noted is that often they don't provide resources to juveniles, to folks who are under 18. However, you mentioned that the community that Health 34 is going to be serving is anyone on the physical UC Davis campus. So I'm assuming that includes youth as well. I'm curious if you could talk a little bit about the considerations that might, in some jurisdictions, kind of define this hard point between after 18 and under 18, and how you are working through that in Health 34.
That's a really good question, because it is a very challenging area. And it's also honestly part of why we aren't in the clinical space. We can serve people of all age demographics as compassionate humans who can be there with them through a hard moment. And we will have services that we're able to navigate them to. But again, a piece of this is that it requires a little bit of initiation on the individual's part, especially going to a provider that is not a campus provider, that's outside of our jurisdictional boundaries. So it's part of why a relationship with the 3 counties is so important, the youth programs that they have. Honestly, the calls that we have, that is a very unusual demographic within our jurisdiction. So while we know that other jurisdictions will have significant challenges associated with it, we think that by having a service navigation piece that enlightens people to the services that are available to them regardless of age is actually a really effective way of getting people to those resources, in a way that you can have those interactions regardless of age.
Thank you. So I know we have folks in our audience who are affiliated with the campus, staff, students, faculty, and then also members of our community not affiliated with UC Davis. As folks kind of digest this information about Health 34, a lot was presented. What would you say kind of the takeaways that you would like people to think about and perhaps share among the communities that they belong to, the communities they work with, and the communities that they serve.
Cory, you want to start?
Yes, thank you, Chief Nate. I want to know that UC Davis, we are a compassionate campus, and the word compassionate and compassion, I think Chief Nate used it several times during his presentation. And we're trying to do better. Chief Nate mentioned that we are flying the plane as we built it. We're building it at the same time. And so we're looking at ways that we can improve on what we're doing currently, and I think UC Davis is the perfect space right now with the leadership that we have, the innovative staff that we have, the students that we have to be able to make this program successful on campus. And I think with everyone's help, we will be successful on campus. Chief, thanks.
I want to encourage people to reframe their ideas on how we care about each other. And it sounds maybe a little utopian, but part of the challenges that we face in these spaces that we talked about today is somewhat of a normative cultural issue of if it doesn't directly affect me, it's not my problem. And one of the beautiful things that I think Health 34 looks to deliver on is this idea that we're done telling people it's not our problem. We're here to say it is our problem, because our community's health and well-being is our problem, and we have to find solutions. And the solutions don't belong to any one group. It belongs to all of us. If it takes one group that navigates you to everyone, that's fine. But we all need to own the challenges that are going on in our communities today. We can't keep saying it's not our problem. And I'm really proud of UC Davis for being bold and for taking that stance on how we care about our community. And this doesn't solve all the problems that are out there. It doesn't solve all the problems with what is truly a healthcare system under pressure around social justice and other important issues. But it does make a very meaningful attempt to show that we care and that people matter and people's outcomes matter. And so I want people, when they watch this and walk away from it, to think about how this looks to deliver on it and what role they can play. If you're part of a community group that services anyone on our campus or beyond in their moment of need, how do you get tied in? How do you become a part of being a support system when people have bad days before the crisis, when they've had a bad day after the crisis? How do we stop things from getting worse? We have to do something.
Thank you so much. And I want to thank you, Chief Trauernicht and Dr. Vu, again for that really excellent, inspiring presentation. I hope that we can take that call for action and see how we each can be involved, and looking forward to hearing more about the rollout of Health 34. So as we leave, I want to first share that the recording from today's event will be made available on the Book Project website. And finally, we welcome your feedback on today's event and invite you to complete a brief survey, which you can access via the QR code or web address listed on the screen. As an incentive, and thank you for your participation, at the end of the survey, you will have an opportunity to enter into a prize drawing for a copy of this year's Book Project selection. Again, thank you to our presenters, thank you to our participants for joining us today, and we look forward to seeing you at a future program.